Good afternoon, everybody. Thursday, June the 8th, 2 p.m., Kern Valley Healthcare District Board of Directors meeting. And let's start off with our flags. So forgive me, I need to call it to order, which we've done, but approval of agenda. Pages 1 through 4. Do we have any changes to agenda as presented? No motion to so move. So move second. All in favor?
Aye.
Nice. Okay. Forgive me. Flag salute, Mr. Blythe, and invocation, Miss Catherine.
Yes.
Please place your right hand over your heart and repeat after me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please join me for the invocation. Lord, I just want to come before you right now and ask that you continue to be with each and every member on this board, the community, the employees that work here. I just want to know that we're in your will, Lord, and that we are providing the services that we need to provide, that we are fulfilling our commitment to the community as elected officials, Lord. And I just ask that you, with the beautiful water and the beautiful river that's going on right now, I just ask that you keep people out, keep people safe as they enjoy their summer here. I just ask all these things in your name. Amen.
Amen. Thank you. Our mission statement is on the agenda for everyone to read. So, public comment. Do we have anyone from the public that wishes to be heard on items not appearing on the agenda at this time? All right, seeing none. Consent agenda. The following items are considered non-controversial by hospital staff and will be acted on in one single motion unless anyone wishes to have one of those items removed, and we can discuss later. Do we have any changes to consent?
I'll move to approve the consent agenda.
Okay, thank you, Ross. Have a second?
A second.
Thank you, Gene. All in favor?
Aye.
Aye. Thank you. All right, so moved. Okay, let's run to reports. Ms. Hess,
Good afternoon.
hello.
So the foundation towards the end of this month will be reaching out to Parks and Rec at the county to hopefully have some kind of answer on whether or not Riverside Park will actually have electricity by August. If not, we will need to make a determination of where we're going to move River Rhythms. We talked about Wilford Heights Park. There's been some talk of Tank Park and also Mount Mesa Park, but no set decision has been made really. We do have 3 bands that are confirmed. We're waiting on the last one to confirm with us. The foundation is also looking to replace the stage that we currently have due to safety reasons from last year. So we're hoping to be able to make that purchase and have that here before August. Crab Fest planning has started and we expect to have tickets out and available to the public at the end of this month. And also the foundation had started a scholarship program, which we awarded the first year and then we went into COVID. So this past May, we just awarded about $2,000 scholarships to 2 seniors at Kern Valley High School. And those funds were raised through River Rhythms. Any questions regarding foundation? Okay, and then I missed last month's meeting, so I wanted to let you know the auxiliary income last month was just over $6,700. And May's income was over $11,000. So we're doing really well there. The skilled nursing actually went and shopped today, and we'll have another group coming on Tuesday, June 13th. And then I do need to get with Tim so we can start talking about having auxiliaries man the hospital, the lobby, and whatever other departments. Any questions?
On the shed for out here, the cover.
Yes.
I don't know if Bob is going to be able to talk to you today, but can you tell what we're asking for?
Yeah, we talked about, we went 20 by 80 and 30 by 80.
Okay, so will anybody talk about it?
Not really, we haven't got any information yet to share, but we've kind of identified the size that needs to be done, and so we'll get into a little bit more what's going on here, so.
Okay,
But yeah, it's on our list, so for next building and planning. We'll have it.
Thank you, Deb.
Just had a quick question on the scholarships that you gave up. Are those for students that are going into the medical field or just any?
It would be medical field, STEM, or public safety.
Oh, okay. Okay, cool. Thank you.
Nice. Okay. Any other questions for Deb? Oh, okay.
Thank you.
Yeah. Medical staff report, Dr. Fenstead.
That would be me.
That's you?
Again,
It's changed.
he's gonna start paying me some of his directorship. Keep giving his reports for him. Just again, P&T committee met on May 24th. We discussed COVID-19 preparations under old business. We also reviewed, approved 10 policies. And again, a whole range of things. I'll let you know if you're interested. 2 policies are still in progress. This was abuse, neglect, and exploitation and abuse prevention program protection. The committee discussed and approved sepsis protocol, which is great. We're working on that for a while. The committee also reviewed and approved an addition of SUTAB to the formulary. They also reviewed and approved a formulary for the sniff Pyxis machine. They also reviewed and approved the annual MERP plan, the medication error reduction program. The committee approved the submission of KVHD antibiograms to the antimicrobial stewardship certification packet. The committee reviewed regular reports, blood usage, blood cultures, a whole host of other clinical things, Foley catheter use and so forth that we have to report on. Med Exec committee met on May 30th. Committee reviewed and approved the 10 policies that were discussed above. One policy approved with changes, that was the community acquired pneumonia antimicrobial selection. The committee also discussed progress on the ultrasound guided regional anesthesia program. The committee reviewed and approved the sepsis protocols. The committee reviewed and approved the change to 2 medications on the formulary. And they also reviewed their regular reports, which is quite a deal. So that was the medical staff report for Jan.
Any questions for Tim on behalf of Dr. Fenstead?
I don't have any.
Jean? No. Okay, thank you, sir. Yes, now let's move on to CEO. Okay.
It seems like we have been surveyed to death here in the last couple months. I know the staff certainly has felt that. We started off with our survey on the acute side that was both a licensing and a certification survey. And took us a while to kind of get through that. I'm not going to go into too much detail. I think Mark's going to talk about it in his report. Then when that was, as we were getting that one done, we ended up, they came back for a survey of our skilled nursing facility, and this was a federal survey. Again, pleased to report that we had only 3 deficiencies. We have submitted the plan of correction on that. One of them, I think they've approved outright. 2 others, they required a little bit more information about that. Don't know if we've gotten that back. Oh, you did? Okay, great. So it must not have been the big ones. Okay, good. So we're waiting back to hear on that. Our hope is that that will get cleared as well. And so considering that they haven't been surveyed in over 3 years, to only have 3 findings is remarkable. Because normally the state average from 1 year to the next is anywhere from 10 to 14. So again, that was really so a lot. And they had 8 surveyors here for 3-4 days. So and they went through everything. And so that really spoke well to the staff over there and the preparation and so forth. So we're very, very pleased with that. Again, I talked about it before on one of the other committee meetings. Again, we had a little emergency crisis here with regards to the water in Mountain Mesa. 3 o'clock in the morning, the water disappeared, from the faucets and everything else. And Bob, appreciate him, came in right away. We immediately put our emergency plans into place of, red bagging the toilets and so forth, so to collect that stuff. Since there was no water coming back in, or if someone were to use them. And then, obviously making sure that we had emergency water supplies available, right, if they needed them and so forth. We had reached out to CDPH, we reached out to the county operations emergency center. Just in the event that this was something beyond a simple fix, that if we needed, emergency supplies and water and those kinds of things, that we could have access to those. So, and again, that went well. Luckily, like I said, they reached out to Erskine Water, and apparently there was just a switch that had gone bad and so forth that they had recently replaced with some kind of a solar powered switch. And so of course they switched back to the old mechanism, and was working probably in about 45 minutes, maybe a little longer, that the water was back up and so forth. And so we called on everyone else. Yeah.
Should we have our own reserve tank? No, I'm not talking about.
Ultimately, we will, because as part of the seismic upgrade to the facility, when you get to a level 5 classification, you're required to have a tanked water. And the plan has always been that we would dig up the helipad and bury it inside the helipad and then put a new surface back on top of it that protected it, keeps it cool from the weather and everything else. And so
You could put a swimming pool at my house.
it wouldn't be that hard to run a hose down there from there. But yeah, that's the plan. That's actually a requirement as part of the seismic upgrades. So anyway, so that ultimately cleared, and I think the agencies in Bakersfield were very pleased to be notified. The state called us the next day, wanting to know what happened and so forth, and we shared that with them, and they were very appreciative that we let them know. Normally I would have just called Jane Chang, who was the director down there, because she always shared her cell phone with us. I said, the new person, Camilla, is in place, and I have not really had a chance to meet with her yet, but I want to get to that point where I've got that kind of a relationship with her. Jean, she'd expect me to call at 2 o'clock in the morning if we had an incident like that. She said, I want to know. And she says, if I need to help direct things or get my staff involved to help you guys out, what I want to do. So, as they've had some changes down there, we just haven't had a chance to meet those folks yet. We've talked to them on the phone, but it's not yet to the point where we can do that. So, but anyway, it's like I said, it's just, and then we had a life safety survey that came in as a part of the SNF survey and so forth. And I think we have 8 findings from that one, and most of them were not. There were issues with the water system, the standpipes and those kinds of things. So Bob's got a plan on all of those already. They were not that difficult to fix, and so forth. So one was we actually had, again, it's typically IT. They put some 4 cables through a wall and forgot to put the fire patch around the things and stuff like that. So, and yet 3 feet away, we actually had an approved assembly for putting wires through the wall to protect it. And so it's like, it's right there. But anyway, it worked, and that's been repaired. I think Carrie, for him getting involved, 2 minutes, right? So, but like I said, it's just one of those things that they just, every time they go through a wall, they have to know, because they've got a patch behind it and so forth. So that's been resolved, and people have been re-educated and so forth. You spoke about SB 525. That was the bill that the groups up in Sacramento are trying to get pushed through. That was originally going to push through a $25 per hour minimum wage for the employees. That bill was modified to reduce it, I think effective June 1, to $21 an hour as of 2024. And then in June 1 of 2025, it would then jump to 25. So their plan is to do it with a 2-step process. No matter what, that's going to be a huge financial burden on every hospital. I don't care what their resources are. And it's not just, we did Dave did a quick study for me and so forth in terms of what the impacts were going to be, for us. Without the compression, just for the cost of increasing those people who were at or below that. And so forth. But the compression is really where some of the big dollars come, because now everybody that was between 1550 and 25 or 21 now got to be pushed up above those, because those were more complicated, complex jobs, and so forth. So those folks can't be at the same level as minimum wage now. So, and that's where the real big expense comes with doing this stuff, and that would probably wipe out a ton of hospitals in the state, especially the rurals. Who just don't have the reimbursement, you know, the state wants to push this stuff down on us. But yet, again, for 10 years, they've never approved an increase in rates for Medi-Cal. And so forth, and it's just, we've got major hospitals like Kauai Delta that are on the verge of going under because they're defaulting on their bonds because of their reimbursement structure. And, they're begging for financial help. And so this is, CHA is working very, very hard to try and fight this. And, again, we're writing letters and making phone calls and doing all that stuff as well. So that's first bill. Not sure where that's going. It has some sizable support behind it because they tried this a year ago. And it didn't.
In your report, could you figure what it would cost to balance it out? How long we would have to have extra money to make it work?
Forever, because the rates will be at
Well,
that level.
no, I'm talking about the overall, everything's gonna come up or everybody will be out of business. And if
So
we're
we
inefficient-
should assume that the state will increase our payments. They'll be forced.
Yeah, there's gotta be some assumption there. I mean. we're
If that were to
efficient.
happen, it would be fine. Like I said, I think that's the big problem.
Well,
is
if
because
we're
there's been
running
no-
efficient, it'll happen regardless. It's going to go up.
Can only get so efficient, Chief.
So figure the assumptions. Can you do that?
I mean, we could make the assumption that the state will be fair and whatever the cost is, that they would increase our rates a similar amount.
I mean, we're getting 73 cents on the dollar per cost
And
now.
over a period of time,
So-
what would it cost us
I
to
don't
put
care
it
how many
on?
years.
And-
it is.
Carry it until we balance out.
Whether that's a reasonable assumption, like Tim says, I don't, I could do that and then everyone could feel good about the program because it does look fine as long as it's gonna be a funded mandate versus right now, like just about every other program that comes down from the state.
It
is
has to
unfunded.
be funded. We'll go to business if it's not.
But everything
We're not
else
the
they
only
do
hospital
is
in California.
Everything else they do is unfunded.
Yeah, they're not gonna fund it.
The seismic
We have to
upgrades
make
was
the assumption We're
unfunded.
not getting the money.
Nursing
That's my
ratios
point,
was
yeah.
unfunded, took on all this extra staff to meet those ratios and again, no money to help cover those costs. And so there's only so much that the hospitals can absorb. That's really what it comes down to.
Could you
This is
at
a
least,
huge increase.
just generally, Dave, look at sort of.
Yeah,
Jen.
I've got a general look at it already. and
Oh, do you?
We can we can get by for a while because we're in such good financials, but a lot of other hospitals don't have that luxury.
But if you had to tap into that for that reason, then there goes your building.
Yeah.
Exactly, building projects.
You just can't do it.
What's the impact on us annually without compression?
It's a 7-figure number, low 7 figures.
Okay,
So
that's without compression.
without. And that's be a pretty big piece when you jump that high,
Correct.
so.
Yeah.
So anyway, that's the other bill, like I said, was SB 616. This is the bill that was going to, when COVID came in, the concern was that some of your non-benefited employees didn't have sick time, and so therefore they would lose out and so forth. That or they were coming to work sick because they did the hours that they were getting. And so forth, so that the state mandated that we add 3 days of PTO, paid sick leave, for them to cover that every year. And so forth, and so, and our thought was, or hope was that would go, once the pandemic was over, that would go back to the way it was. But no, when they do something, it's permanent, so.
Tim, is that all industries are just the medical or hospital?
My understanding was just the hospitals,
Yeah.
healthcare.
They expanded it a little bit that
Yeah.
if you're on the premises, you also, except they eliminated UPS drop off.
Right.
But in many cases, even outside of healthcare, if you're on the premises, you qualify. for medical
Consulting.
leave.
So you can't contract it out until.
If we have
Exactly.
contractors, yes, they have to.
They also.
And that applies same thing to the $25 minimum rule. So if we were paying $15 to our security guards and the thing goes up to $25, even though our employees go up, they have to get paid $25 too. So it's not just our employees.
Okay.
So it actually goes beyond that. And we didn't take that into our model.
No, I didn't put that
But
on.
that's just how absurd some of this stuff gets. So the plan with this bill is to increase that from 3 days per year to 7 days per year. Which is interesting because the pandemic's over. So now why are we jumping this up? So again, it's just a way of making sure that everybody's got benefits. So even when they've opted not to have them, you still get them, and then they want to make it so that those will carry over from one year to the next. Before it was you use them or lose them kind of thing. And so now they want
Carryover versus payout.
correct. So that was my we are, again, I think it's about, we have on next Tuesday, we've got a kind of a half day meeting with the managers. We're taking them over to Ewing's and doing a really kind of a team building thing. Coming out of COVID, it had an impact on everybody. I mean, and we understand it with the community and so forth, but our managers too, our ability to work as a team, I think has been impacted. And it's just, like I said, we want to get the managers refocused and going in the right direction. We're bringing a speaker. I had an opportunity to speak with him today with Cassandra. I think he's going to be great. He's a futurist, but he's not the traditional futurist kind of thing. And so, we kind of talked about the history of what's gone here at the hospital and some of the crises we've had to face, Erskine fire and some of these things, and so forth. And just, how the hospital team has always rallied around those crises. And the issue becomes, how do you get them to do that in normal everyday time? It's like I said, always seem to come together as a team when there's a real big need going on, but we should all be that team every single day and so forth. And so that's what he's going to try to help us get to. So very excited about it. I think it's going to be a lot of fun, and they got some work to do. And so, but I think it's going to be well worth it. And I think people are going to come away with some tools that they can bring back and help be better managers and so forth. So that's what we're trying to do. We are again, we've now officially started our emergency generator project. They started, we got the trailer, RNF trailer pulled out of there, which was a big effort that we thought. Nobody in California wants to move trailers. And yesterday started putting up the fencing back there. Have they added any more, Bob, from where we were yesterday?
They've removed the gravel where we're in a trench.
Okay. Yeah. So, but yeah, there's gonna block off because the wires have to run under that sidewalk right outside the ED. From there all the way over to the lab. So we're gonna have to have metal plates put on the ground and bridge that. And then they're putting fencing up all around that. There'll be fencing to allow the ambulance to offload their patients and so forth. Another one for the patients going up into the CT scanner. Then another one over by the lab to let general public, are coming into the ED park and so forth. And that'll last a couple of weeks, I think, is what he told me. And so forth. And then once they get those pipes and stuff covered back up, because that's the power that's going to actually run. That we're going to run into surgery and up over the roof to power, bring that emergency power to the rest of the hospital that doesn't have it right now. So when we decided to go full scope on that, that's what that meant. And so that was really needed. So anyways, that work's going to start. And then they'll start down the other end, putting the pad in and clearing that out to put the actual generator in place. So kind of nice to see that going. It's getting a lot of people talking and questioning this kind of thing. So kind of an early preparation from when we start the other project. So that's underway. And that's pretty much my report. Like I said, it's just, we've been surveyed to death. I think, like I said, we're coming out pretty well on all that stuff. Mark's been actively putting the monitoring systems in place to make sure that when we said we're going to do this, that there's a tracking tool that comes to him or me or to the medical committees to make sure that they're actually being done. So we can follow through. So we don't ever want to get caught on that again and so forth. But so anyway, I'll let him speak more about that. But that's my report.
Questions for Tim?
Yeah, just one quick question, Tim, about coming back to the state bill about the wage increase.
5.5.
Yeah, 525, thank you. Yeah, I know that the state has way too many unfunded mandates, but is there a way for maybe the hospitals and the state that are against this, and you do some kind of collaborative? I mean, I know that the California Hospital Associations and the ACHE, they do a lot of advocacy work.
That's what we're doing. Yeah, they've reached out to every one of us.
The SEIU has just shown that they're stronger than that lobby, other lobby.
Yeah.
I'm just thinking, like, go tell the state legislature, like, these are the impacts, we can't survive on cost plus 1%
Well,
reimbursement.
these were the things we're writing the letters, we're making phone calls, to our representatives and stuff like that, and to the authors of the bill even. Just to say, listen, this is not sustainable under any circumstance. We just don't have those kind of margins where you can just come in and jack up those prices. I mean, unless the state's willing to kick in, and it's not even just the state, because they're just one of the payers we deal with.
Yeah.
Everybody's got an increase of our costs go up. So, and that's a challenge, because they're not going to just do it because, they've got to put, higher wages in. That's not their problem. So, yeah, it's going to be a tough thing. But I think, like I said, because of I think if they had taken a different approach and just like gradually did this over 10 years or something like that, or like I said, the last one they did a $5 increase, but it was spread over 5.5 years, 6 years, and stuff like that. And so this one is just so dramatic, from where we are right now, from $15.50 to $25, whatever. That's what they were originally proposing. Even to 21, it's still, $5.56 an hour more. It's a big jump, and then to 25 the year after. So, yeah, that's a pretty loud message that the hospitals have. And like I said, it's not just the hospitals, it's all facilities, it's skilled nursing facilities and so forth. They don't have those margins. I mean, they flat out, there's no way they could do that. They'd all go under, and so this is huge. So it's not just the hospital industry or hospital association, it's all those related organizations as well that are going on with that. So.
Do we get any support from the state bureaucracy like Department of Healthcare Services with a proposal like this, which obviously will impact healthcare in California statewide?
Yeah.
Do they speak up and say, wait a minute?
I've not heard one word from them at all. I think, again, they're just kind of, we're out of that fight, it's not ours. So, it's just, like I said, even like I said, when they did the ratio issue, because they were a part of that, even though that was another union sponsored bill that came through, it ultimately, they had to be the ones to now monitor and make sure that was happening. So, I mean, and even with that, they never came out and say anything.
Do we have
This
a
is
way?
our job now. This is what we've been told. We follow what the legislature tells us. So.
Do we have a way to reach out to different legislatures?
Yeah, I can certainly I can send you a list. Absolutely.
Because our own are Republicans in
Right, and that's
a
what they're-
super majority.
That's what they're telling us. It's a super
They can't do
majority
anything
of
about it.
Democrats.
Right.
And it's just unprecedented how concentrated it is.
Talking
right
to
now.
our reps is like, just preach it to the choir. They know, they
And-
get it.
And they're very.
It's like I said, an IRAP
They can't do
obviously
anything about it.
is the price of all the hospitals in Bakersfield.
Yeah.
And plus us, and so we're all calling him, events and stuff like that. And so, and this is a Senate bill, so this would actually be Shannon,
Nobody's gonna listen to her in Sacramento.
No.
No, it's,
So,
we have no vote.
Right.
Um,
and
So
I think it's what they're counting on.
maybe we reach out to some more reasonable Democratic legislators that are out of our area
There are
and
efforts.
appeal to them?
There are efforts that are being done through those hospitals, and like I said, they're sharing that in the
Okay.
meetings,
All right.
and so forth. So,
Jim, there's a lot of good that could happen from that bill going through. If we tried to work with them and tried to find a way to make it happen, rather than just saying, hey, I don't want that to happen. I mean, if we could make it happen, it'd be awesome for the hospital.
CHA tried that a year ago. They, as you may recall, they tied the $25 bill to the effort to reduce the seismic requirements, which would have required the hospitals only to upgrade their ERs and surgery and some other ancillaries associated with that, like laboratories and so forth. So in the event of an emergency.
Maybe they could get with all the people.
And that,
that pay
because
it.
the magnitude of the $25, just, there was nobody that could get past that. And so ultimately the hospital association to back out of that deal.
They-
So forth. And the unions came back and said, nope, we're gonna go back and we're gonna put it again next year. And that's what this is. So they're attempting.
Yeah, if they could get our reimbursements done up front along with it.
That's the key. It has to be up front.
Right, yeah.
Because if you even wait 3 months, some of these hospitals.
Are we trying it or are we just saying, go away? I mean,
There
It would
are,
be a
I will
good
share with
thing.
you right now, there are conversations going on with the hospital association, with the governor. They were trying to be honest, get a $1.5 billion aid bill coming back to the hospitals to help us, especially these hospitals that are in stretch urgent financial situations, okay? To try and at least get some relief there, because, you know, like I said, you've got a number of hospitals that are in the same situation that Korea Delta is in, you know, and like I said, you
well, Medicare does.
fail
it
your
for-
bonds,
For
you're
regions, right?
stuck.
So maybe they could bump our regions and, you know,
We have talked to the governor and there appears to be no interest in doing that. We've been talking about that with him for years and complaining every single year that you've got to increase these rates. You can't keep doing this to us. You know, the cost of care goes up every year. We have to pay our employees more each year. You know, you've got your supply costs going up. You've got insurance costs going up. So you've got all these things going on and they just refuse to address it.
I know, I get sick every time I look, when I come in here for service and what we get reimbursed is disgusting.
Oh, yeah.
I mean, what you guys do for what they're paying is,
Yeah.
it's not right.
I agree.
So,
And that's the problem we're in, Gene. I mean, it really is.
1%.
Tim, do you think they're trying to make healthcare more attractive for people to, as a career path? Are they trying to do that? What is their motivation?
To be honest with you, I think they're trying to scare people away from it. I
that-
don't know how that would make it attractive to anybody.
Mark, that you're right, because more people, as we're getting older, and hopefully I'll get a little bit older, that they need more people in a medical.
You're absolutely right. You're
I
absolutely
mean,
correct.
they just need them. That's one way, Mark, you're 100% correct. I think that's the ultimate goal.
Yeah. Well, this is that paradigm that came with the baby boomers. The baby boomers have now aged to the point where
Right,
they're
right.
now they're retiring, they need those healthcare services and they're not available. You know, and now we've got the compounding factor of COVID and the pandemic, which people have just walked away from the industry. Not only nurses and you know, lab techs and stuff like that, physicians have left.
But we should
Just
try to
stop
find a way
providing
to
this.
work with them to try to make it happen. And all I hear is don't make it happen. I just seems like there would be a better way.
I wish there was, you know, like I said, I think everybody is trying everything they possibly can to figure out how we can get through this. But, you know, again, when there's no explanation for how did you come up with that number, you know, they don't care. They just said, we want this number. And
What's interesting is there's an article in the KP Monthly Journal from a couple months back praising this program, which almost makes me need to believe are they the one charging.
no, because they're paying their people already.
That's my point.
Because it's coming out of
That's
the
what I mean.
van,
Are they
right?
the ones leading the charge on this thing for more of a medical grab industry wide?
Very possible. Because that's the issue, because again, a lot of the providers up in the Bay Area, because of cost of living and everything else, are already at
They're
that
already
rate.
there.
So they're not going to be impacted by this at all.
Correct.
It's the outlying areas and, you know, every place in between.
Right, yes.
They're the ones going to get screwed.
Tim, can I ask one question about the SB 616?
Yeah.
Is that for non-benefited employees, you said?
Yes,
Okay, that's why I just wanted to.
but actually it adds on to everyone's. So, but they primarily did it because of the unbenefited. So
Okay.
everybody, even our, that was something that the board approved us to do that for all.
For all employees, okay. Thank you.
Pure.
Well, if CHA is not successful, then really the only option, if it's approved, is to seek a veto. Which we should do with everything that we got. is ask the governor to veto it.
It's an interesting thought. I don't know where he stands. He has really not said much about it.
But we need to tell him what the real impacts will be.
Yeah, well, like I
Right
said,
here,
if-
right here in Kern Grove Valley.
if he has aspirations on a national level, which as a speech I heard this morning, it certainly sounds like it. He can't let that happen. You know, he would be crucified
Right.
on a national stage to let your healthcare system collapse.
Yeah.
You know, that would be suicide. So, yeah, I think because of that, there may be an opportunity that he.
So we need to sharpen our pencils, get that number, what this is gonna cost Kern Valley on an annual basis, and then without compression and with compression.
Right.
And unless you couple this with reimbursement, it's just not unrealistic. It's not sustainable.
And
Another real life example, I was in a CFO meeting, hospital CFOs, about 50 of them. And one of them brought up this topic of, are you gonna put this increase in your budget for next year, starting in July, like we're gonna be talking about later? And the ones that said they are, or decided not to, they said, if you put the dollar impact in upfront, you're forced to conclude that you'll have to do layoffs immediately. So if the legislators only understood the direct impact of that rule will be less jobs, because you can't afford that many people anymore.
Yeah.
There's only so much money you can devote towards salaries. And it's an immediate 90% of the CFO said, yeah, we'll have to do layoffs.
So and we need to paint this picture succinctly. That will result in layoffs, and how does that then translate to the community? It's less access for medical care. We have fewer providers, we have fewer capacity to serve our community.
Right.
We have a lousy medical system because of this legislation.
Right.
And when we need to paint that picture.
And how do you lay off staff when you have ratio requirements?
Exactly.
People.
Exactly.
right.
You have fewer patients, you refuse.
You refuse patients.
You probably have to give up services,
Yeah.
which reduces access.
It's a spiral. It's just, that's what's saying.
If it's not tied to reimbursement, it can't happen.
Well, would an increase to the population in the skilled nursing make a difference?
Not that much of a difference.
Well, it'll help.
Not that
Which is
much.
it? No, it won't, or yes, it'll help, or?
It will help, but not enough to.
It's not gonna create a positive financial picture, is what that's the answer, you know. It's just not. So, you know, it's just.
The cost of just the wages on our budget with all the other costs. Does it really make that much overall difference? Total.
If you don't count any compression, maybe you could argue that you could somehow get by, but it's not realistic to assume that the person that's got more training, is a more complex job, is not going to also move up in salary when they're at the new minimum wage number, that you're going to have to bump all those people.
But they wouldn't expect the same amount, right? If it's 25% or 30%, you could negotiate compression. Right?
Well, yeah, and like I said, we did that. The last time we did the adjustment, when we had the last increase, not the 50-cent one, but the one before, we did a $1 increase.
Yeah.
One went from $14 to $15. We asked the board to approve to take our minimum wage up to $16 or $17 for the CNAs, because we wanted to stay ahead of that, because we don't want them having to go back now and think, well, gee, I can still get my 15, 16 bucks over at Burger King, versus working here in the hard job. That's one of the hardest jobs there is. And so, but to go to that high, it's just, there's no way that works. There's no way that works without the additional
reimbursement needs to be higher. We need to work on higher reimbursement. If we're going to fight, that should be our fight.
Absolutely. It's the only way it makes sense.
And I think that's our strategy with the governor. If this goes through without reimbursement, that's our argument, is this isn't feasible without some way for you to pay for it, right? Because we can't pay for it.
Well, and even the money, like I said, last year he was promoting that he had $30-40 million in surplus. Okay, which we found out was not really there. But, you know, even then, like I said, he refused to approve any measure that was going to be an ongoing disbursement. If we only do one-time fixes. And so, well, payroll, things like that are ongoing, you know, you can't just do it one time, and, you know, so. So that's the problem. So,
You know, if the state's unwilling to make that commitment in their budget for those ongoing expenses, then don't do it.
The biggest one is Medicare for us, isn't it? Or Medicare,
Medi-Cal, they're probably about the same there.
Well, yeah, Medi-Cal pays even a much lower percentage than Medicare does. Which is neither one of them are anywhere close to what our costs are.
Yeah, right.
Yeah, I know mine, when I see what we paid, I mean, again, can't figure out how we're open.
And I've always often said that statement to myself, that it's a miracle that hospitals can survive based on all these dynamics.
Yeah, but they're all awesome and everybody pulls together. All that.
Yeah.
And there's philanthropy, there's other supplemental things that somehow help us keep our doors open, but it's
Those can be turned off at any time. too.
yeah, and I mean, there's winners and losers. There's some really sophisticated big systems that, you know, are getting paid better, but the ones that seem to need it the most, they have higher percentage of Medicare and Medi-Cal, they're not getting.
Kevin might be in a position to help us if they do it regionally. I know there are places where it's not as expensive, so the reimbursement is different.
Right.
And so his ear is normally there.
And unfortunately, like I said, he doesn't dip into, I mean, he certainly would comment probably on it, but obviously he doesn't dip into state politics, you know,
Well,
it's all
he's
federal.
responsible for this dam. He made sure.
Yeah, but that was through the Army Corps of Engineers, so it's a federal project, you know. But yeah, I mean, certainly
Well, Medicare is not.
value his opinion, but
Medicare is
on
for
that.
Anyway, I've said it, I'm sorry.
Yeah, no, this is an important issue. I think we really need to spend some time talking about it.
Is it my turn yet?
No, the last I heard, this is more than a 50% chance that the assembly and the governor will sign it,
Right.
that it's a very high percentage.
So can you, Dave, start working on bullet points, impacts to the community?
Sure.
Based on the cost of this, an unreimbursed cost of this, and so we can start framing a request for VDOT
Narrative, yeah.
Request for reimbursement increases.
They can't.
Also,
He's got a bill in front of him. He's gonna sign it or not. He
well, he
can't.
just said he's gonna sign it. Dave, you just said he's. gonna sign it.
Everybody's guessing that he will, but
Okay,
I'm listening to Tim, and Tim's right, it's political suicide if the result of that is that his reputation, if he tries to run for office at the federal level, that there's
He's already in that,
Did
he
you
has that
say his
issue going already.
reputation?
To
how did you damage his reputation?
He's got issues.
predict what a politician's gonna do.
That would be just
Probably need to
on
stay
top of
away from
everything
that.
else.
If we could craft a brilliant
Yeah.
little write-up on
Yeah.
what the impacts are gonna be, then blast it to editorial boards across the state.
Yeah. Well, and then again, we at Delta did that. I mean, they had their CEO put a letter out to literally everybody that looked at it and so forth, and they still have that financial help out of it. But, you know, like I said, I think he encouraged all of us that you have to do it. You know, because this happened just after, what was it? What was it closed? Madera, yes, right. So, and now he's being impacted because a lot of the patients from Madera ended up in his,
Yeah.
right? So now he's got more volume. That's not covered his costs
Man.
and made it even worse for him. So just to get this trickle down effect. So. Fun times.
Obviously, you've got your hands full.
Obviously, we all, yeah,
Catherine, any
everybody
question?
gets.
No more questions. I don't think you.
Gene? Sterling? Okay.
All right, Mark. Don't.
Oh, sorry. Hello, everyone. So I usually report COVID numbers, but there are no numbers to report. May, we saw 0 COVID patients.
Good.
So there was one admission early in June, and that patient was here for 3 days and was discharged home and didn't even complete the course of treatment, so we're fine. So COVID in our community is pretty much 0%, in my humble opinion. The transportation service, we're still providing 9 to 11 rides every day and making trips to Bakersfield and Ridgecrest. A few of those trips were canceled due to the canyon closure and things like that. But now that it's back open, we're still doing those. We have ordered credit card readers for the drivers to be able to start charging any service that goes out of the valley. We're going to charge 60 cents per mile, payable upon before they leave. So that's kind of the plan.
Is that Mark, Department of Transportation? I know they've got rules and regulations on how you and who you can charge and how much you can charge.
Well, the federal reimbursement rate is around 65.5 cents per mile now.
But can we charge you?
We are under that.
I didn't know you guys were charging. I'd have to look at that.
Okay.
We haven't done
Would
it
you
yet.
mind? Because seems like it's.
Yes, I will definitely look at it.
Yeah, it might run afoul of a bunch of different.
Yeah,
rates.
let's look at that. There is a service, one of the guys that we gave a ride to locally here was saying that he's going to have to pay $100 to get down to Bakersfield for a ride. So, and it wasn't for our service, but he was just telling our driver that's what another service is charging. So, and then Tim talked a little bit about the CDPH revisit. It was accepted and they found no deficient practices. They have accepted all of our audits and plans of correction going forward. The CAPS committee meeting will be reviewing those audits and making recommended process improvements where necessary. Those minutes go to P&T as a report, and then they also go to quality as a report. So that's why those were accepted. So and Dina and I have worked it out to be able to get those over to the quality committee. So, and then we revamped the district-wide orientation process. There were a lot of redundancies in how we were doing it. So it's now a 2-day process instead of a 3 or 4 day process. So I'm glad to say that it's been a focus of mine for a long time, but we've been able to kind of pare that down a little bit and just kind of streamline it. All of the mandates that are California keeps laying on people to as far as LMS and learning is concerned, the mandatory abuse training, mandatory HIPAA and privacy, mandatory whatever, all these different mandatory trainings, everybody has to have that before they go to work. But we were rehashing it halfway through their process. We were going over it twice. So we've been able to revamp it and get rid of some of those redundancies. And I think that's it. Yeah, that in a nutshell is my report.
Thank you.
You're welcome.
Brett, I have some questions.
Sir, please.
So Mark, Tim deferred to you the details on the acute audit, and you
Yep.
didn't provide any details. So how many findings did we get? What, is there anything still pending? What-
So there were no deficiencies on our current audit practice. We've corrected I think there were, Heidi, help me, 8.
On state, we had, remember we had 2, you had the state and you had the federal.
Yeah, we had the state and the federal, and I think the total was 13 deficiencies. Yeah, and we've addressed every one of those, and they came back for a revisit, found a few other things that they didn't like so well, but then in their revisit, they came back and everything was all up to snuff. I can go into detail if you'd like, but we can have a discussion as long as we just did about the state mandates, if you'd like.
I don't need the length of time. I just wanted to know if everything was okay.
Everything's good now, yeah.
Yeah, the survey theory came up.
We've put a few monitoring tools in place. The house supervisor has daily audits that they have to do. The infection preventionist does daily audits and hand washing, environment of care rounds. We had to change the storage room of where we store clean equipment on Med Surg. That has been done. So we're, they really looked at the rest of how we implemented all those processes. And we're very happy last week when they were here.
We had a great survey team that came up. Like I said, we weren't expecting them that quickly.
Yeah.
As a matter of fact, we didn't even realize when we were sitting here in the exit conference, I had to ask the surveyor, I says, we've never been told that our plan of correction was approved from the visit before that. And she goes, no, she says, well, it was approved back on May 15th. And here we are like at the end of May, and just now, we didn't know that it had been accepted and so forth. So they forgot to send it to us. So, but like I said, so they came out and they just said, no, he says it's going to be a very short meeting, if we're no findings. So,
Great.
Yeah, they were very pleased with what we did. And they pointed out some things too. I think, they saw some things, he said, I'm not writing you up on, he said, but just I'm bringing it to your attention just to kind of watch for. And Mark, they paid real close attention to that and so forth. So he's already dealt with that
Well,
stuff.
I corrected it right then and there.
Yeah, right.
And
But, they were great and just, again, they understood what we've done to get to that point and so forth, but so they weren't going to hit us again. But it's just like sometimes you can walk into a room and if you do it every single day, lose sight of some things,
Sure.
and a sign on the wall, or things like that is kind of what it was like. So.
Thanks, Mark.
Any other questions for Mark?
Nope.
Kathy.
No, thank you.
Okay. Dave? Floor is yours, sir.
Okay, we're gonna start out on page 24. I'll give you some time to get there. And my presentation for the month of April will be brief because we have budget to talk about too. So right below line 34, you see the line labeled total net surplus. And this is for the month of April, 700,519. You see that number? Okay, you see that one of our best months compares favorably to the budget of 324. So it's 376,000 ahead of the budget for the month. The operative word of the month is employee retention credit, ERC, and that's the federal program because we succeeded in qualifying and receiving a $3 million payment. And I feel the need to emphasize this isn't something that every hospital gets. I think only 3 out of 45 district hospitals have received it so far. So I really want to applaud our team. When we think of our performance throughout the year, we look at the bottom line. In this case, our bottom line was good for the month, but for the year, it doesn't look like we're doing as well. And we say, well, even with the extra money, we're still not performing well. We're performing administratively when we can start bringing in this extra money. And just to give an example of the individuals on our team that play a role in that. Dina Griffith, she's very good at finding money for us. And for example, we got the most we've ever got this year on our SHIP grant. That was a high amount we received. Grade for QIP does a great job of making sure, and that's a real high amount compared to other hospitals, 1.5 million. Tim brought it to our attention, this EFC program. So it takes a whole team. So when you look at FTEs and you say, well, we had 225 FTEs, that's way too many compared to our revenues. Well, that 3 million is part of our revenues too. And we may or may not have gotten it if we didn't have good performance coming out of these individuals. That Bob Easterday, obviously, if we get that FEMA grant, that's going to be huge, 22 million. Deb Hess works on a lot of things to get us money with the foundation and auxiliary. And then you have the support staff, IT and accounting and HR, all that data that it takes to submit these reports. So I want to just take a minute and pause and say, yeah, look, if you want to say we're not doing as well this year, that we're underperforming well, you need to give those folks some credit that we got this $3 million in, and it's true money that's really gonna help us.
Yeah, that's, you guys did an awesome job, there's no question. And I know what you've gone through, and you were instrumental too, you didn't mention yourself,
Well,
but you.
I got lucky. I tried it in a few creative ways. When you submit to the government, you just got to figure out where to put in the boxes. And the first time we tried it, it didn't work. And then we were lucky to figure out an alternative way.
They like that, except they don't like me on 415.
So moving on to a more negative topic, operating expenses, line 28. You can see 3,480,000, 789,000 over budget. You see that number in red, just to the right on row 28. Well, about $500,000 of that is not, it's ERC expense. So that's not all, real for that month. It was, obviously we had to pay our employees for the state ERC.
See, when you got a number like that where it's 700 over budget, if we don't have the money, it don't make no difference, right? I mean, they can't get it.
Yeah, that's one way of looking at it. So the moving on to page, if there's any questions else on page 24.
So I think the issue, the important part there is that was a one-time hit. Or at least half of it, because the other half will come in.
Yeah, and keep in mind
too, right?
that when we do the May financials, there's going to be another 1.5. We only showed half of this in April. There's another 1 point, and that all is going to go to the bottom line in May. So we're kind of going to have 2 meetings where we can do that celebration about how it's impacting in the numbers that we see. Technically, I can't show that for April because the check came in on May 1st. Yeah, the second check.
And Tim got 2.2 million on the PVP, and that, I mean, that's
absolutely. Those are all things that don't automatically come to us. We have to have competent staff that does their job, and we feel real good about, at least for this year, that this is a part of our performance that's gone well. On the other side, we are looking at the expenses. This is higher than what we expect. We're going to be spending more time with the departments and looking at FTE creep. We've got some departments that have gone up in FTEs without the corresponding increase in volume, asking tougher questions, kind of doing more what Chet did all these years to keep us in line. And I probably haven't done as good a job at being a little bit tougher with the departments and making sure that the day-to-day reporting of their staffing is that they explain the variances and make corrections.
Can I make a comment? I know we don't agree all the time, but I don't know anything about accounting, really, just general. And you're doing an awesome job.
Thank you. Like I said, it's a team, and the person that comes to mind that for me personally is Tim. This organization would not have performing without your CEO, and that's where the buck stops. And so I don't like to, I appreciate the compliment, but I always want to deflect it to the person that really deserves it. He's here all day fighting the battles. All these problems that come up, they all fall on his shoulders. Unfortunately, I get to pick and choose the ones I want to help him solve.
That's right.
The page 25. So our bottom line, the net surplus below line 34, you can see 1,575,000. Now keep in mind, 1.5 million is going to be added to that. That pushes it over 3 million, right? Now that 3 million may not be where we finish the year, because if we do some bonuses, use some of that money, give back to the employees, it'll probably be in the mid-2s somewhere, but it'll still be a good year financially, and we'll be able to keep on track with our cash flow and other issues if we move forward on the bonus. But my point is that 1.5 million isn't, even though we're only 2 months before the end of the fiscal year, it's going to go up considerably from that number because we haven't recorded all the 3 million yet. That's pretty much the common theme for the year is truly we have had a reduction in patient volumes in many areas. Although ER is an exception to that, ER has continued to be busy, and probably with this lake filling up, probably is going to continue to be a growth area. But so if you look at line 6, one way to quantify how much the volume impact has hurt us, you can see the total gross revenue number of 98 million compared to the budget of 109 million. You see the variance there is $11 million. If you understand how you convert gross to net, you take that 11 million and you multiply it by 20%, because that's what we get paid, 20 cents on the dollar. So 11 million times 20% is $2 million to the bottom line if we would have hit our numbers on budget. That's how much our bottom line would have been higher, because we underperformed in certain areas that we talked about at Finance Committee. So that's my report for the month of April. Any questions or comments?
Mr. Elliott?
No.
Kathy? Pete?
Nope.
Mr. Blair?
Just, I noticed on the adjusted financial strength, I must have missed
Yes.
the finance meeting. I think that's the first time I've seen that before.
And and that was, I could have digressed into that, even at finance, and I didn't. We received a report back from the bank that we have our major financing with, US Bank.
Right.
They changed the formula that in terms of how they count our days, our cash balances, and they added some things that Chet had left out because of the way it used to be. Now we get to count more of our cash, which as soon as I put that into the formula and it recalculated, it went up higher to 4.6. So it's a more updated look at our overall picture, including our liquidity, is now giving us more credit than we had before, because we get to count more categories that wasn't in the original formula. The bank's allowing it to not be considered restricted cash.
Is it legal to ask how Chet's doing?
Yeah,
I mean,
and I've heard he's getting better, but I haven't heard much else besides that.
I actually talked with him 2 weeks ago.
oh, really?
Yes, I did.
Is he able to?
Yeah, he was on LinkedIn. That's how I found out.
Yeah, I got.
He messaged me, so we just said hello and said,
Oh,
tell
great.
everybody hello.
Oh,
Great. I think he's doing better.
good, good.
Any other questions for Dave? All right, thank you, sir. Okay, moving on, old business is none. New business, this is the big one for you. Budget presentation, sir.
Okay, and if you go to page 73. I color coded it because it's after. And during the presentation with the Finance Committee, we made some minor tweaks to what we call budget 1, and now we're looking at budget 2. And I'll explain the differences as we go through each page. So the page 74 is the key assumptions. And what we presented at Finance Committee, service expansion was, I believe, 870,000. If you go on line 1 and you see that number, that's now 515. Well, it was higher before because we had some higher numbers in that were challenged, and we all agreed that it was probably not realistic in the clinics. Greg has reported recently how hard it is for us to recruit practitioners. I had a higher number in there for clinic volume. We took that number down, and unfortunately, Greg, your FTEs are also lower because of that. But so obviously, if the volumes are there, you can have more staff. But we had to marry up the staffing with that, so that it hurt our bottom line, but not as much, because on a productivity basis, you have to budget the way your volumes are. So if your volumes are higher, then you can have more. It just kind of works that way. So that was one of the changes we made in budget number 2. Similarly, the line item labeled GI lab. So we're in section 1 still, we're on the second line down, GI lab ophthalmology general surgery. That was cut in half in terms of a ramp up on those services and whether Dr. Buxton would be as busy as what we had originally in the model. We lowered those expectations to try to be more, try to shoot down the middle in terms of our estimates on revenues and volumes. So those were slight tweaks to what we had presented at Finance Committee. And you can see the clinic line is, instead of a 10% increase, now we're showing that the clinic volumes is going to go down by 2.5%. And you see that on in the section, in the middle of the section 1 labeled service expansion clinics. Go to the far right and you see the down 2.5% there. So that's the new budgeted assumption on volumes. The overall bottom line on section 2 operating performance, net income. You see the new orange number on net income, 1,159,000 versus gray. You don't have orange.
I have it on my.
On the gray, 1,159,000. That's slightly less than what we showed in Finance Committee, but it's still a similar number, but a little bit less because of the volume problems. One of the things too,
For example,
yes,
then that 1.15 million net income would be completely gone if we had to pay wages at SP.
good example.
It'd be gone.
Good gone.
Yeah.
Yeah, so that's a good way of putting those two topics together. One thing new this year for transparency purposes and to be more patient friendly, we did a much lower rate increase. You can see the line 3 inflation rates, the price rate increase. You can see every year up till this current year, we've done historically done 7%. Well, we're only doing 2% this year, and we can publicize that and say, hey, look, we're trying to be responsible in the community and not increase our rates any more than we have to. Now, the reality of it is that not much of that would have gone to the bottom line anyway. So it just kind of makes people angry, in my opinion, unnecessarily, because they see this big charge, but really the insurance company's going to pay whatever they paid. It's not, it only affects the people that don't have insurance at all, which is not good either. So we're trying to be more sensitive to that whole topic as there's more federal scrutiny on hospitals to not put people in hardship situations financially. And one of the things we can do is start lowering our rate increase.
The amount of people that are uninsured now is almost none, right?
Yeah, I mean, I talked to my son, he's working full time, but he doesn't want to pay the premium. I said, if you ever get stuck in the ER, you know what that bill's gonna be? And if they're gonna take your car, you know.
Well, you're gonna end up with some, again, you've got a lot of people that got onto the Medi-Cal program because of the pandemic, because they suspended that annual view that they did. And I think they're expecting, I can't remember, it was like 8 million people or something like that they're planning that probably will lose their Medi-Cal. Now they're restarting that eligibility process again. So
most of the plans though,
yeah,
it's like $1 a month. If they get up a Medi-Cal and have to pay.
if they go through the exchange, yeah.
The only downside is they'll have like a $7,000 or $8,000 out of pocket over the year.
Right.
But we would recover a good part of that. And so, but at any rate, people are going to have insurance and they're out of pocket generally.
Yeah.
Now, line item 6, IGTs, is significant because if you look at the two columns on the right, the projected column of 8,424,000 and the budget of 12,328,000, that's a 4 million swing. And what in effect that is one program that got delayed 2 months that should have been in fiscal 23 of 1.8 million doubles up the following year. So it's like a 4 million swing. So instead of getting 1.8 like we should have in both years, we're getting it all next year's budget.
This doesn't include the 2 million that we learned last night, remember?
No, that was part of that.
Is this part of this?
Yeah.
Okay, all right.
Yeah, I wish it was actually, I would be honest,
Yeah.
but I had to put that in the budget
We
already.
just learned.
So what I'm thinking of doing, and I'm just gonna just briefly, without actually showing you an example, it's probably dangerous to even bring it up, but there's gonna be a new term that I'm gonna bring up along with an analysis that you'll see called normalization. Because what I want to do for all of us is we want to be certain that in any given year, when we try to analyze our performance, at a minimum, we need to expect that we're going to at least break even on cash flow from normal operations. Now, how do you define normal operations? If you have a situation where you have a payment that is earmarked for a given year, and it's labeled that way, it's a 2023 program, and then you get paid the following year. That's really to normalize it. You need to move that money to the year you should have got it. And similarly, so it either hurts you or helps you in that given year, but it skews how you're doing in that given year. What I want to do at the bottom of my report going forward is show you a normalization such that when we look at that number, if we're doing better than zero on cash flow, when you take out all that extra stuff, because what we don't want to do is we don't want to rely on extra stuff that normally doesn't come in.
Yeah, like over the
Yeah.
last 3 or
Yeah,
4 years.
exactly. We want to eliminate all that and eliminate the big ticket project
Yeah,
costs, because
yeah,
that's not normal either. You know, the master project, because, you know, just outside of the master project on the negative side and outside of all these supplemental money that we can't rely on all the
That
time.
is very cool.
So I'm gonna do that going
Yeah.
forward. But this is an example of where you'd see, you know, some normalization when you have 1 year, the 2 years of IGTs that being $4 million apart. Just for a minor reason, like a 2-month delay. So going down to section 8, in the gray, the top number, paid FTEs. That new number at 230 is a 2.7% increase in staffing. That's 6 FTEs, mostly in the areas that are growth, like OR, skilled nursing, and retail pharmacy. So the only areas that we're allowing an increase also includes increase in volumes. So any questions on the first page before I move on?
Just one statement for you.
Sure.
Number 4, under expense inflation,
Uh-huh.
property casualty insurance.
Yeah,
I think you're low on your projection.
you know, and I,
Just an FYI.
we're not gonna get the final number until next week, but you're probably right.
Oh, yeah, I'm quite sure of it.
So we're trying, I didn't know what to put in there. We put 20%.
Right.
We've got, you know, when we talk about the challenges for hospitals, one of the things I was gonna highlight is an example, that's a good example on how our costs are, you know, way higher than we're not getting paid, there's no reimbursement that corresponds to that. Similarly, our health premiums, which is a good number, 8.4%, that we're not getting 8.4% more Medicare and Medicaid. Okay, that's another higher number than what, you know, we're funded. Well, the cost of supplies and pharmaceuticals going way up. There was one other line item that we found out recently was a real high increase in costs. I can't remember off the top of my head, but on average, it's clearly inflation has really hit us more this year than other years with a lot of line items like that are much higher than what we normally would want to budget, the 3 to 4% increases every year, because that's how much we get paid. We don't want our overall cost to go much more than that, because then all of a sudden you're negatively cash flowing from normal operation. And if you negatively cash flow every year from normal, sooner or later you're going to run out of money.
Everything seems to be going up more quicker now. Back when it was 9%, it wasn't going up much at all.
Right,
So that's what you're saying, right?
that's what I'm saying.
Catching up to us and we're getting caught up in it.
And what was it, I know unemployment was, also a higher increase. I can't remember what percentage that is. Anyway, let's go on
That'll
to.
save us money on that $25, the unemployment.
That's true.
I might raise it.
Yeah. Page 75. Again, the highlighted gray items are changes from how I presented in the finance committee. Clinic visits being a 2% drop. Surgeries, not as much of an increase, but it's still a hefty increase in with these no programs that hopefully get going next budget year. I don't have anything more specifically to talk about, except that we have to make sure now that COVID's over with, line 11, that we get our average length of stay back under 4.0. So we're gonna have to keep a close eye on that, as the number's been coming down nicely this current fiscal year. We need to see that new trend. Page 76. Increases. You can see line 1, gross patient revenue, the far right column, 5.8%. So it's not a huge pie in the sky increase in revenues and volumes. It's intended to be conservative.
So 2% of that is the price. increase.
Exactly.
3.8.
So it's not really major. We would like to think we could hit those numbers. There is a line item 4. Some of the money on our balance sheet has to start coming in for previous money we received for HHS stimulus. So I have to show that on line 4 and other revenue. So we're going to budget for it. So it's not going to be any surprise. It'll make us look good, but it really was a prior year thing that Chet didn't put on the bottom line. But eventually we have to put it on we can't leave it on the balance sheet as a payable if we don't have to pay it back. So now that we have a higher confidence that we don't have to pay it back, we need to start showing it as profit. But we put it in the budget, so it's kind of a non-budgeted issue because it's there. Doesn't make us look like we're outperforming because it's in the budget. Other than that, you can see another line item that 14. Wait a minute, not 14. All right, now that wasn't what I was going to talk about. The line item 9. The reason why that number is going down is instead of putting this ERC bonus, if we end up moving forward on the discussion that we're going to have later in this meeting, it's like a 700,000 or 800,000 hit. I decided to put that number on line 9 in the projected 23 column. You see the number 3,534,561. You can see how that's more than the number right next to it of 2,991,888. So you could ask the question, why is it going down so much? Well, it's artificially high on projected 23 because I added 800,000 if we end up going forward before the end of the fiscal year with that bonus. But you can see even with that bonus in there, the bottom line for the current year that we're in, line 17, you can see that number 2,849,000. So we're still projecting to have a really good year, even if we give out that bonus. So that's the budget. 1,159,000 is what we're recommending to be approved for next year as terms of the net income. The cash, the only thing I wanted to emphasize on cash on the balance sheet is the line item 1. We're going to have we're going to start significantly going through our money. And that's because we're assuming that we're going to go through phases 1, 2, 3 of the master project, plus the emergency generator, and a lot of line items that you'll see on the last page of my budget report coming up in the next couple of pages. So, because there's like a $10 million capital budget that comes out of cash. So you see cash going from 24,288,000 down to 15,206,000. Now, if we get the FEMA grant, that'll eventually catch up. Now, but we're going to be spending 10 million this first year, but it's only assumed based on how Bob Easterday explained it to me, is it kind of trickles in at the beginning. They don't send us all 22 million at the beginning. We've got to get reimbursed, takes time to send the paperwork in. I put 1.3 million out of that 10 million that will get some of it in.
What's the odds that we might get lucky and get that? You think 50-50 or?
It's starting to sound more like a 50-50.
Yeah, you know, the issue is, I mean, because the grant we submitted last time was pretty much the same. It was a little more detailed this time. And we had, you know, the consultants from the state helping us, you know, making sure that we put everything in the right box, all this other stuff. But FEMA had approved that grant request from 2 or 3 years ago. The issue was, hey, because all of the monies were flowing to the state of California, and California was supposed to distribute those funds, because well, all those things went to the state. And so we were told we ran out of money. So even though your project got approved by FEMA, there's no money to pay for it. So we're putting it in this time, and FEMA changed the program. This time FEMA's releasing the money. And so the state just approved our proposal and then forwarded it on to FEMA. So now FEMA's reviewing that. We're hopeful that they will see it with the same eye they did last
That
time.
sounds really good.
That's why we're feeling that way. I wouldn't come out and just say, yeah, it's no slam dunk, you know, because you don't know what's up against it. But the fact was that they approved it once.
That's another reason we need that shed down there so we can dance.
So moving on, unless there's questions on, we're going to move on to page 78. A lot of detail here on each line item. Just to point out that the line item 10 AR receipts in the budget column is a lower number than what we had in the first budget because of the changes I made on the assumptions for clinic and OR volumes. It cut about $1 million out of how much we're going to actually collect if we're not as busy. So that obviously hurts our line item 34 ending cash balances. That 15,206,000 was over 16 million in the original budget presented to Finance Committee. So we lost about $1 million due to the change volumes in those areas. So the other thing I wanted to point out is how in line items 36 through 41, the way we historically keep our funds into various accounts, whether it's in LAIF or construction reserve or project fund, that we're moving more money into the higher rate of return areas, like line item 39. It should be UBS, not USB. UBS is that firm that we hired to invest our securities that's earning 5% interest. The reason why that's important, you can actually see that there's a line item 18, see it, interest income. You see the trend of line 18, how it starts out at 134, 669, goes up to 229, 122, 439. Next year, 922,000, because we're taking advantage of these higher rates that we're getting right now. Philosophically, I'm also thinking more about the big picture, that it might not be such a bad idea for us to take on more debt going forward, because if you're only paying 3% on the new debt and you can earn 5%, you know, that's a nice trade-off.
Longer than short-term debt.
Yeah.
What's the average length of the bond you're buying? How far into the future are you considering 5%?
That's true. Will 5% remain? I think it's going to go higher, my own personal feeling, but who knows? Obviously, if it goes back down to less than 1% like it did for many years, then you could argue that my theories are wrong. I just like the flexibility of having more cash. The third-party creditors that do Moody's and rate they always say cash is king. So anytime you have that flexibility, you can maneuver your organization better by having that liquidity. And by having more borrowing, obviously, you're and then make other investments in other projects because you have that cash available. And if you push that out to 30 or 40 years, I'm just kind of giving you a hint at some of the things I might be bringing up in later meetings. So,
But I think, again, we've talked about, again, we've tried to keep those securities at a max of 2 years. Because like I said, and primarily it's because it's tied to when we need the cash.
when we need the
building
cash,
project.
but if we get a combination of 22 million FEMA and let's say another 8 million in new borrowing, we can still have high cash balances and keep earning $1 million a year as long as the rates stay.
Because we can go longer term, maybe 4 or 5 years at that.
It's just something to think about. It obviously has to be a collective
Yeah.
decision,
Yeah.
but it's just how I'm thinking right now based on current circumstances. But that's my cash flow report. The other main part of this presentation has to do with, and I don't know how many people are here to present their capital items.
Don't know, we've never done it that way.
Okay.
And like I said, because a lot of them are working, and so,
Okay.
because they're gonna come back and present at the point in time that they actually need to buy it.
That's
So you gotta go
It would
through
be
the
an overkill to
CER
do both,
process,
yeah.
right?
So you can see the line items there. If you guys have any questions of any particular ones, we can certainly come back next meeting and give you a more detailed description of the page 79, the barcode scanning, the smart pumps, the blood gas analyzer, the delivery carts, the ultrasound table, IT equipment. Of course, carryout spend has to have money in there. And a mammal unit, which
Yeah.
the significance of the mammal unit is even if we can't do everything because of the coding, we still feel like it's a service that's needed in the community. And that would be another big line item, 275,000. You can see there's a lot in the column labeled building and planning. You see that number at the bottom of building and planning, 4,252,000. That's not even part of what Bob has been telling you guys is the 34 million on the master project. This is above and beyond that. Because we moved some of those items out, like the emergency generator. And some of these other line items that we're discussing in building and planning, that's all cash flow that I have to put in my budget. Because it's gonna come out of the bank account when we spend the money. So in addition to the 4.2 million I have in building and planning capital spending, we also have the category just to the right of that labeled master project, phases 1, 2, and 3, which is another 5 million. So the total that we're asking for in the new budget on page 79 in the far right corner, 9,843,134.
Do we need a motion on that? Good.
To accept the budget.
I would like to make a motion to get it started. I know there's discussion.
So every year you do your budget, your investment policy and your appropriations limit in one resolution. And so I think we should bring that back in July with all the final numbers. We can approve it all
I'll
at
bring it
once.
Yeah.
Yeah.
All right.
So the board's supposed to review the investment policy annually. So what we do is we've just, and you're a pretty,
Approved this year anyway, so that investment policy.
well, the debt
Modify
limit
that.
policy was, yeah, because the debt limit
Right.
policy was added.
Right.
And you're a pre-prop 13 agency, so you have the appropriations cap.
Yeah.
So,
Okay, so we'll bring it all for the July meeting.
yeah,
Pull it all together. Okay, that's fine with me because we can still proceed accordingly. Assuming, the board has heard the presentation and at this stage, there's no major changes.
There's one thing I didn't see in here. It looks like you're gonna need a lot more numbers. Can we purchase a bunch of numbers for you?
Are my numbers getting small enough for you? What I can start doing is a 50-page report where these big fonts. For people our age.
Let's see.
Mr. Elliott, any question? No, I appreciate Dave, the work you put in on this. I think you're assumptions are sound. It looks hopeful. Look good.
Thank you. I get excited about the budget process because I get a chance being remote to spend time with each individual manager. One-on-one, we talk, they tell me what's going on in their department. We get into specific details and I get educated why they need this position, what's going on here, why this cost is going up and what challenges they're having. And they get a chance to know me a little better. So there's like 25 managers that all get also credit for this, that, you know, it's their work that I kind of put it together.
And then he has to come and sell.
Ms.
me
Catherine?
out, So.
And I think most of them have given me some pretty good reviews that they like the process.
Gene, question?
I was thinking at the same time you were gonna say, John deserves a lot of credit.
Well, he's been chair of finance. I think we should.
Yeah, I think the board should get a pay increase in the budget.
Is that a motion? We could
Let that legal out.
We could put that in the budget if you want to add a little bit to the stipend.
It'll be our last
Any
motion.
questions on that? Comment, everything looks great. He's got his head on his shoulder.
Thank you.
You guys are giving me a big head. So, you know, I was complaining to Tim earlier. I was glad that all these compliments have gone away because I was feeling embarrassed.
It's all right. We'll knock you down. Don't worry.
We don't want you to feel like Rodney Dangerfield. No respect.
It really is a team effort, and I hope the other individuals feel like theirs should get, you know, like Barbara and IT, and it's like everybody. It takes a village.
Thank you. All right, let's move on to employee retention credit distribution, Mr. Boyd.
Yeah, we kind of chatted about this a little bit in a couple of meetings and stuff like that. You know, the board's desire and mine as well to, you know, again, coming through this pandemic. You know, and obviously the huge inflationary adjustments that we've seen that our employees have had to bear. And so the board had kind of asked us to kind of put together some ideas as to, you know, what we could do. One of the, again, we kind of knew where we were going to come in with the 2.8 million and so forth. And I think, you know, this was strategy was really kind of based upon trying to maximize, you know, as much money towards the building project as we can. And so our goal was really to try and get at least 2 million of that money put back into the project. Because we know every dollar counts on that. And then, and that's not to say later on that if we get FEMA, we all this stuff, when we come through and we got money left, we couldn't do another one later. But the plan right now, like I said, was to try and take that excess money above the 2 million and distribute that out to the employees. And like I said, that comes out to about between 757,000 and 783,000, 84,000. And like I said, it really is just more of a philosophy. You know, again, we had several discussions and just some thoughts come up again, just the full timers. I mean, to kind of go a straight plan and just, you know, the full timers get, you know, like I said, 3,700 because, you know, that is going to be taxable and so forth. The part timers, we put it at 3,000. And these are for the part timers and per diems that were actually working more than 30 hours. So in many respects, they almost qualify for full time benefits and those kinds of things if they do it long enough. But yeah, some people are just, you know, voluntarily, they want the hours, they just didn't need benefits and those kinds of things. So, you know, again, we try to, and there's not a lot of them, it's 13 total that fall into that category. And then the other part-times that are below 30 hours on average, and the per diems, you know, which again, they've committed to you know, work when we need them to work or when they're available. And so, but, you know, we kind of looked at it from the perspective, you know, again, and some of them just don't need benefits because they may be covered by their spouse or whatever. And they probably fall into that higher group up there. But, you know, so like I said, we try to, you know, come up with some kind of a scale here that kind of reflects those efforts and so forth. And that really represents example one. Example two was really, and again, we try to take a look at that because our managers have done a great job, you know, throughout the pandemic. There's a lot of work and requirements that were placed on them. And the idea was we come up with something extra for them and then try to spread that back out to the others. The question that I think that you know, again, when we kind of look at this initially, the numbers that we had several employees who are out there in temp positions who is just short term. I mean, so the question is, should we add those into here? My gut tells me no. It's and that's why I'm putting it out to the board, because it really is your decision. It's on this thing. And so, because again, these might have been students that were here for a CNA class, and ultimately left, or, whatever. I mean, obviously some of them are still here. These are ones that could be in the class right now, although there's 8 of them. So it's from a prior period. But what's that? They're from right now. Okay.
Tim,
Yeah.
question that
Yeah.
part of it. If they're not with us anymore, they're probably gonna get a retention bonus from somebody
Somewhere
else
else.
anyway.
And-
So why would we
Yeah,
give
the
them?
state-
a-
So one of the
Right, I
theories could
agree
be, we're retaining the ones that we currently have.
Right,
now.
that's what we want to do.
We don't want to lose them.
Precisely, precisely. So that's why I said I would probably take that out, and I would probably roll those funds up.
Well,
There's not
okay,
getting
Tim-
only 5 people there.
Tim, if I can,
Yeah.
there's people, you probably I make $3,600 a year, okay, roughly.
Yeah.
And you make more than that, so let's say roughly 300,000.
No.
And at this table, do you feel like you're worth more than I? I mean, Jim, I can't believe we're giving a manager $3,700 and a janitor $1,000. Why aren't they all the same? They all gave the same. That's like when in the army, if you're private or a general, we're all giving the same.
Yeah.
You're all dying the same. I
That-
can't believe there would be a difference. That's.
Yeah, I know, and you've brought that point up before, it's like I said, you asked me to put together my thoughts on this, this is what I'm giving. Clearly, I think if the board feels that same way, then fine, we would just take this number and we divide it out and everybody would get the same thing.
I would be happier approving the lesser amount, the 700,000.
Yeah.
Than splitting it.
Yeah.
If it were more fairly distributed. That's my opinion.
I would argue that person that has a higher wage may feel offended that the percentage of what they're getting is significantly less than what other employees are getting, and that they're not isn't feeling this valued is important because they only got a 1/2 of 1%, the other person got a 5%.
I would feel so proud that I shared with people that needed help more than I did. It's not part of their wages.
It's just
think
another
it
way of
would be
looking
an
at it.
Awesome thing to be fair.
Well, and that's what we try to do, it's like I
Okay.
said, we again recognize on top of this, we gave $500 to the majority of our staff this last year in order to get them the maximum on the state, because the state matched what we put in. So they ended up with $2,000 from there. They put 1,000 in, plus we put 500 in, and the state matched our 500 to get them 2,000. So that's on top of this money.
Yeah.
So, again, so we want to keep track of that as well. So, it's just, I looked at it from the perspective that, again, the full timers made a commitment to this organization. That's the bulk of them. Made a commitment to be here every day, work those hours. And so, trying to recognize that effort. Obviously, you've got some per diem folks who, while they are in a position where they aren't expected to work those hours, some of them are. We have 13 people that are actually working greater than 30 hours. So, and again, that was why we felt the need to recognize that effort, okay?
Are they
And likewise, the
employees?
per diems and the part-timers who aren't committing to be here, except, again, that's why we end up with a fair number of per diems sometimes. It's just because, like I said, you call them up, say, hey, I need a shift covered tomorrow or something like that. Says, well, no, I got something I gotta do, so
They're not employees, are they? Per diem?
Yeah,
I mean,
absolutely.
we pay them like employees, but they're
they
not.
actually get paid
They're not
more.
committed, I know, but they're not committed to us as an employee.
Hence the pay difference here, okay? That was the rationale behind this. Okay? So I see where you're coming from, and I don't disagree, but if everything was on the same plane. I just personally don't see it that way,
The
because
managers were carved out as well.
not to say they're not valuable to us, they are, trust me, because we couldn't do it without them.
The managers were carved out of the $1,500.
The
That's
state
right.
program paid the manager zero.
Right. So
Yeah.
again, another reason why the
If they
manager.
got the same as everybody
No,
else,
they didn't. They got
They
zero.
got zero.
zero.
They
They
didn't
got
get zero.
The only one would be Tim.
None of the
Should get
exec,
zero.
none of the exempt folks.
I was
said it.
joking
Yeah.
with you there too. Because of your bonus.
I understand.
You take a skilled RN that is in a position, to really make a difference in a person's health status. Doesn't that mean anything? Does-
Opposed to what?
Okay, let me go back to the military thing, right? You're all in the line of fire. A private over here gets shot and a captain over here gets shot.
Yeah.
What's more
Well, so
important?
Audie Murphy.
What's more, yeah, what's more
So what
important?
he did, he got promoted and he started making more money.
No, he didn't.
Yeah, he did.
He got promoted.
And he made out real well financially because he got the reward of.
Learn how to fly a plane.
Is this something we need to vote on today?
So I'm going to ask you not to vote on it today.
Thank you.
And that's because for government agencies, bonuses for public employees are illegal unless there is statutory authorization for it or it was previously approved and earned. So what you're doing is you're giving a retroactive bonus based on money that you're getting from the Fed.
77, please dial extension
And
301.
so what I would
77,
feel better
please
about
dial extension
is if we put a
301.
resolution together explaining the legal basis for the payment to the employees, because it's otherwise not allowed by law.
Now, if you're gonna do that, can you at least, like you've got two in here now, do one the way that I think it should be fair to everyone? Because I was there in the height of the damn COVID, and the people that showed up that were making the minimum wage, they were there and they were, it was just part of a team. And I couldn't see a value more.
So what I'll do is I'll write a resolution where you attach the bonus structure as an exhibit. And you can have a couple of different bonus structures, and whichever one the board votes to approve, will attach that as the exhibit to the resolution.
The only question I have on this, and I could be wrong, so forgive me. The timeline that we're talking about with the ERC money,
We can do it anytime.
I know it's not what I'm referring to, because obviously there was a timeline involved of the employees, in other words, date A to date B. Those employees that were embattled in here that are still here with us are the ones that should be getting the rewards of that, not all of us.
Right.
It's kind of,
Right.
Yeah.
That makes sense.
Yeah.
Problem is, we can't pay people that are already gone.
I'm not saying to pay the ones that are gone, I'm
And
saying that we
nor should
reverse
we.
the ones that are here.
But
This
how,
is retention.
This is a retention bonus.
Right,
for-
and that's what this.
If they're not here anymore, they don't get paid.
is there a timeline? Because right now we got the money. And if they just left yesterday, does that entitle, I mean, recently? Since we got the money, does that?
We can do it anytime. But it sounds like we have some hoops we have to jump through to make it legal.
Why would we want to do that? If this.
No, I'm
if
not
this-
saying we want to do,
Yeah.
I'm saying that we
This
obligate.
is a retention bonus.
Right.
We're wanting to provide an incentive for those employees that stuck with us.
Since we,
They're not here anymore. They're-
since they were there till recently though, and we got the money before they left. And that's, I'm saying, are we obligated? I'm not saying we should do it.
And not in my mind.
Yes.
Any thoughts?
Like I said, we just, again. I welcome any comments from the board or whatever, or things you would like us to go back and remodel.
Understand.
You know, again, I think if we can agree that we're gonna try to stick to that 750, 780 level, then we can go back and we can model this any way you want.
I'd like to see it cut in half. Because it's not gonna make that much of a difference to the master plan. However, it would make a difference to the employees, but
I get that. I think what I'd like to see happen is
Yeah.
we put it to the building now. If we have cash left, we do a second one later. And recognize them at that point in time. But my gut is we're gonna need it.
So my understanding, correct me if I'm wrong on this, because you're more in the weeds on it than I am, is that the ERC is to provide a bonus for the employers who retained their workers through the COVID period.
Basically, they're sending a thank you to all the employers who stuck with their employees to retain them. Even in the midst of having shrinking volumes, which we did, we kept our employees, the federal government saying, here's a check for keeping those employees. Because
It's a refund of your
we had to
taxes.
show them details that we kept our employees.
So my understanding is it's not that you're keeping employees now because the COVID emergency is over.
That's right.
So it's what you did during the COVID emergency
To qualify. To qualify.
to qualify for it.
But however, there are no statutory issues related to
How
once you
money-
receive it, what you have, what limitations you have.
Right, so I just want to make your life as difficult as possible. And I was,
Succeed.
that's why I'm here. And so what I'm saying is, does the board want to look at it as if you're employed with us today? If you were employed with us when COVID started and the emergency was declared and you're still with us? Or if you were with us when it was declared and when it ended? Or how do you want to handle that?
My personal opinion, and we'll take it to everyone else. There was a specific timeline that we had to submit for these funds. And it could have been, we'll call it, June of 2020, June of 21. I don't know the exact timeline. But in my opinion, it's whatever that timeline fell under for this, that's when those individuals should be capable, if they are still with us today. That's my.
Exactly, I'm exactly on the same.
Well, that
page
changes
with you.
those numbers dramatically, because again, some of these are, a bunch of these are new employees that have gone since then, and stuff like that. So,
In my opinion.
yeah, but again, if we go back from the premise that this is an effort to try and continue to keep the people that we've got. Okay, and recognize
Which is
that.
very important.
But legally, that concerns me, because legally, this is the employees you retained during the COVID.
No, that
crisis.
only was what qualified you to
They're
get a
not,
refund.
they're not telling us it's
You
okay.
use the funds any way you
any
want,
way you want.
and none of it's repayable.
We're trying to get as close as we can to what combination of what works for us and what the intent.
That's why we can use 2 million for the building,
Technically, you don't have to hand out a dime.
No,
That's the key.
that's the key.
That's why I'm saying openly, I believe, in my opinion, we go from the timeline involved. Reward those people that have been here and that we've retained and have stayed here. Not the full spectrum.
I think the timeline involved gets us all the way up to when they stopped the emergency. Was that May? They actually said,
You would have had to have submitted your documents for those days.
yeah.
But
You'd have to go
again,
back and
I'm
take a
one
look
of
at what
five.
dates they were looking at financials at. So
Oh, I see that.
that's what he's talking
The
about.
key to it is, Dave, remember, I'm one of five. It depends on what Mr. Joey and Ms. O'Connor and Mr. Parks and Mr. Blythe think as well.
Right.
But
So, yeah.
what's your input?
Well, I think everybody, yes, those are the ones we should be paying. That, they stayed with us, they worked through some hard times and it was hard,
Yes.
but, I would like to see everybody get the same amount, because if you give the managers more, the CNAs that are on the floor,
I don't disagree with that.
I'm just saying, you can't, we don't want the managers to think that, oh, well, why would they get the same amount? When in turn, why would you want a CNA or someone in the laundry to say, am I not worthy of that? I was here too.
So that gets rid of model 2, or example 2. Example 1, though, a good portion of those CNAs that are working full-time, they're in that.
Right.
Right.
Right. I mean, they're still
Yeah, I get that.
full-time employees. I just,
Gotcha.
it's like, who's your favorite kid?
Yeah.
Well,
My only question from this Catherine would be the timeline involved. Are you talking about someone that was stuck with us through the hard times, or the newbie that just came in and just got through probation?
Well, I could justify that up or down, because when you talk to the story of the talents, they got upset because the guy that just came and worked only an hour got the same amount as those that worked 12 hours.
Yeah.
Or that's been here for the.
So
last-
one could argue, how do you measure
Yeah.
fairness? A percentage of what they make could be as a measurement that everyone gets 2% or everybody gets 3%. You could argue that that's the fairness thing, that everybody gets the same percentage of what they currently make. Excuse me. Sorry.
Okay,
Just show it.
I just want to turn to our employees. I want to put you on the spot. What's your perception of fairness?
I don't think a percentage is fair personally.
A percentage of,
Like what Dave was talking about, like a 2% of your salary. I don't think that that's fair. Like our frontline staff, the housekeepers, the CNAs, those ones. I don't know why they would deserve any less than somebody sitting behind a desk or in the office, or I don't think a percentage is fair.
Couldn't you just take the total amount and divide it by employees and come up with the number?
Okay.
Everyone gets the same, whoever's qualified.
Well, yeah, good.
very good. What do you think?
It's hard to
That's it,
understand
employee.
some of the money, but as, I mean, to me, the example one is pretty. I think it's fair. I mean, it's because it's talking about the number of hours that people are working. That's just my personal, a full-time person is the same as an exempt full-time person.
That's correct.
If you're working fewer hours, then you're acquiring slightly lower amount. If you're a true part-time person, then it's even, then it's lower. It's the amount that the employees invested into the institution.
We would just have to show the time frame that we're considering, because otherwise we're gonna have one per diem say, well, I got this, and another per
Right.
diem say, I got
Right.
that, so.
We'll have to define
Unless it's
that.
very
Well, I didn't get
clearly
into that.
defined where we can show them, this is how we reach that calculation.
Right.
We run into trouble.
and I think because
Wait, one more. Terry,
I'll be the oddball. I would think example 2 is the most fair in this situation.
right,
You pay people different wages based on their responsibility. And so maybe somebody's not right there in a patient's face helping them. That's appreciated, of course. But there's a lot of planning, a lot of stress, a lot of all of those things that fall on manager and exempt person.
Potential firing if things don't go well.
Sure.
The higher up you go.
So
You're getting
that-
paid-
I think
you're
that
getting
needs
paid
to
for
be
that
considered.
Not
A
every
blanket
day.
bonus across the board, I actually don't think is fair, because you pay people different wages based upon their job classification, based upon their duties, based upon their responsibility. So that's why I think thing's great, but that's what I would pick.
if we went with one of these. And you got caught at the water fountain. Hearing employees, what are they gonna be saying?
I believe that it would be fair. I mean, that's just that.
Which
In
one?
example 2,
The
I
one
think that
that-
people would think that that was fair. I really do.
Okay, all right. Thank you. I don't mean to put you on the spot, but I think
I like being
it's
put on the
really
spot.
valuable.
I mean, like.
So again, I want to reiterate though, that there was a manager that did come to us who is a working manager that mentioned that they appreciated the efforts from the state on the other ERC, but there were managers who said, how come we got carved out? We work just as hard as our employees.
Right.
So that was something that the managers here missed out on. Yes, we got the 500, but we did not get the other 1,500. So that and that's where that example 2 tends to be a little more reasonable to me. Personally, it is what it is. I appreciate the effort of the district, even considering giving these kinds of bonuses. So.
Yeah, thank you.
And to be honest, like I said, because the employees, like I said, because normally we would give what, $25 a year, usually at Thanksgiving for them to come buy a turkey. And that was, they love that. That's small of a gift. And so when we did the 500, that came straight from us, that was really well received, and then obviously the state, with the monies they kicked in as well. So, it's just, again, because there's not many employers that are doing this, and so, but like I said, and try to develop a model, obviously, we're trying to come up with one.
And that's why we're talking.
Fair, exactly. This is what we need. We need to.
Catherine, you had an additional question.
I do. The employees that are working part-time, is that because they were hired for part-time and there's no full-time position for them?
Could be because the need wasn't there.
Okay,
That's very possible. Other times people have other jobs and stuff like that, so they're actually looking to augment that. And so they'll work part-time for us, whether they're working somewhere else, their prime job or whatever.
And because
That's
they,
true of the per diems as well.
okay, so I mean, they were hired for that. It wasn't like they were hired full-time.
Yeah, because when we put positions out, it's either
It's
labeled
one or the
part-time
other.
or full-time
Okay.
per diem.
Okay,
So a lot of times they make decisions like that, Catherine, based on the fact that they want to dictate their schedule. The per diems, they get to say, no, I don't want to work those shifts or that shift or this shift. So that's one of the reasons. And they know that we still need them on a full-time basis, so they can pick and choose when it comes to that. They also get 8% more to be per diem, 8% more money on their base salary.
Because they're not taking benefits, right?
Any other
Okay.
questions?
no other questions.
It's Judge Parks.
What's 241 divided into that $750,000?
Well, you're gonna take the 10 off, so make it less to.
Roughly, this
Roughly something divided by two, what was it?
241 is the total number of employees.
3,112.
Okay. So that's almost as much. Yeah.
And after this conversation, I need to go back to my 15-year-old granddaughter and say, you don't need to go to college. We've got people out there, they're gonna pay you the same no matter what.
No, yeah.
We're not
that's
gonna,
different.
we're not gonna pay 100,000 for
You
your
know
college.
what? I think that's kind of inappropriate.
This is different. When they came in, when I was there, go there. Whenever it was there and it was ready to bite you in the ass, they were there. It didn't make no difference if they were a
Okay, fair
doctor
enough. I see them.
or so. That's where I was at, and I was there as a patient. So I experienced and I saw the same as a battlefield. There was no difference.
Yeah.
They were there and part of the team.
I can see
The
that.
rank didn't make a damn bit of it. So.
It's,
And Catherine, in response to your the part-time per diem things, again, sometimes they will come in as part-timers. And then once that per diem, that full-time slot opens up, many of them will request, I want to become
Go
full-time.
full-time.
And that we usually do because now they work for us. We know who they are. And we know what they could do. So there's that going on as well.
Well, I appreciate the opportunity to voice my opinion.
Yeah, very much.
It's, there's a lot of people out there with degrees that don't have jobs.
I just like to debate, so I understand what you guys are saying.
I can
It's all valid.
I can justify up or down with you.
Yeah, I can
Either
understand
way.
what you're saying.
But what I'm saying is, I gave my opinion, it will come to us to vote, and if I like it, I'll approve it. If I don't, I'll vote
and that's
against it, and that's when that's when,
That's where Scott will be involved.
Right.
Long before that happens.
oh yeah, well, and if I vote no and everybody else votes yes, then okay, but I'm gonna vote, what I feel is appropriate.
And that's, I guess, what I'm in bringing it here. I wanted that level, because I understood where Gene was coming from, because he's been real clear from day one when we first started talking about that, what he was looking for. But I haven't really heard that from everybody else. And so that is something I need to take into consideration as we look at this. Like I said, I agree. I'm more inclined. I certainly understand the issues with the managers and not being eligible for the state money.
But that wasn't our call.
That wasn't our call. And like I said, we did contribute the 500. That was our call.
Right.
And so that's why I said I'm looking more at example one, because I'm looking at the commitments that's been made to the organization in terms of work hours and those kinds of things, and so forth. And that's and like you ask 100 people, you get 100 different answers on this.
Absolutely.
So it's trying to come up with something that makes sense. That's the difficult part. And that's why I really need your feedback. So I appreciate it.
Right.
Well, I was gonna.
What's your opinion?
We're gonna give you the opportunity, John. Go ahead. You've been so quiet.
No,
I changed that.
I appreciate Ross, asking our staff. I think that their opinion is beneficial. I don't disagree with the timeline aspect either. So would it be maybe advantageous before the next board meeting when we vote on this resolution is maybe try to get some kind of consensus from what's comfortable for the employees? That way we're not, I like to hear from I
It's on
mean,
the ground.
yeah, I mean, I don't want to be dictating my opinion to, oh, this is what you guys, you know what I mean? I mean, that's just.
So let me just say, you had 4 different opinions.
Yeah. You're gonna get two.
You're gonna probably create dissension.
Yeah.
Between every employee against their.
I thank you. That's really good.
I hear what you're saying, but you're gonna have a group of employees that say, we wanted this and you went with that. and
Well, can
that
you give
makes
them
me mad.
the 2 options though? I mean, instead of a million options, try to narrow it to the 2. I mean.
I think if.
Well, those that are getting the lower amount are not gonna agree with it. Because especially if you have a single mom with 3 kids. You know, when you start looking at, I have a 2-income household. And once, you know, there's just so many things that you could look at with
Well, that's why you can't say so.
person, yeah,
Yeah, but-
it just would be tough. But I also work part-time, I guess, per diem, because I like to dictate my own hours too. But I got someone else that pays the bills, so, yeah, it's a tough one.
It is.
So what we need for the next one, because the staff will put together the exhibits that the board ultimately votes on to attach to the resolution. What we need is the timeline, because in order, we need that number for the board to approve. So is there a consensus on the board as to what the time frame is that we're looking for those who are eligible?
I guess I'll expand on that. My personal opinion on the timeline is we need a copy of the submissions, because that's going to give you your legal timeline of filing.
Right.
So that, in my opinion, that's the timeline we follow. Joe, what's your thought on that?
I agree with that approach of who to include.
Okay.
For those employees that worked with us within that period of time. That are still working.
Just to be clear, Fred,
Yeah.
there still are hospitals applying for this program,
I don't deny that.
but that's not the time frame you're looking for.
I'm looking for the time frame that we applied
That
with our
showed our
budget
data.
back, we should.
And the hospitals that are applying today are still have to qualify with those same time periods.
That's
They
true.
haven't changed the time period.
That's correct.
That was regulated.
Yes, Catherine, what's your opinion on that time?
No, the timeline that's fine with me.
Okay.
You know, I wish it would have been something we could have done back when the Erskine Creek fire was going on and things like that. And then I think about the people that, for whatever reason, couldn't work, or how many times did they get COVID while they were working? I mean, there's so many different variables you could think of.
I agree.
So, I don't think there's gonna be anything that we come up with that's gonna be perfect for everybody. Where everybody's gonna, again, have their own opinion, but there's so many variations. Yeah, I agree with the timeline. If you go from, you know, when it was available to us or when we got the money till today or 2 months ago when the pandemic was technically
What they did
ended.
with the ERC money. I need to make it up a little bit, so forgive me. If I was applying for my ERC money from January 1st, 2021 through 12/31 of 21. And if that's the timeline we submitted, that's the timeline that we're referring to.
Right.
That's it. Not before, not after, is why I'm trying to be specific so we don't.
No, I understand. I guess I can look at the word retention. It's okay, you were here, but we still want to retain those that are here now,
Don't deny that.
you know, so that
I
even
just
makes
wish we
it
were getting
more.
more money for them.
We do have more money we could give them.
And that's when I have a little bit of the legal heartburn.
Yes.
Yeah, I was getting heartburn too.
You're welcome. Scott.
On the parks. Opening comments, everybody.
Okay. You're saying that there'll be less employees,
Possible.
A
a
lot.
lot less, yeah, so it's gonna make it a lot more. And
Could
so,
make a bigger pot for those that are still here.
That's true. That's true.
yeah, it will, it'll make it probably another 1,000 or 1,500 each.
Very
So,
possible.
so I'm still to where equal, because I've gone over already why equal. And the reason that where they left and came here, say they left Ridgecrest and came here. Ridgecrest has given their current employees, and we're leaving people in the street because they came with us after that. So they could have gotten the same bonus if they were in a still the same profession, but in a different hospital.
If they were
They
eligible.
didn't qualify.
If they were eligible.
They didn't qualify.
Okay, so we want to treat our employees all the same, just like we were talking about earlier about, this and that. They're all the same. We got to figure they're gonna be just like all the rest of them were. And if nobody in here was in the hospital during the worst part of it. Was there anybody here that was? Yeah, I mean, it was so awesome. You could not believe it. I was so proud.
And once again, and those are the individuals we wish to reward.
Well, tell me the difference in one that's came here a little later and one that was there. Sure, they were in a battle, but they're still in the group or the team.
They still had to wear a mask. They were subject to mistake.
Right, and these are still part of the team now.
I think the key thing is the federal program is for the COVID period.
There's a certain timeline that we submitted.
As I understand it.
Yes, the way I look at the COVID period is when all the way until the point where they said it's no longer, it's.
Was that May 8th? When was it?
Okay, because it was actually a multi-year program, okay? The initial group did not include hospitals. Okay, that didn't come on until the second year when there was a piece of legislation that was passed to add those and a couple of other businesses into this program and so forth. So that's why we only qualify for 1 year. Okay, so that was the difference, so, but it actually was a 2-year program. So
once again, I think we need to follow the guidelines of that.
The ones that are gone,
Applied for is what I'm saying.
the ones that are no longer here, do we go back and pay them if they're somewhere else? Just the current
It's employee
employees.
retention credit, the employees that have stuck with us through this timeline. And we reward them.
It's gonna be probably could be as much as 5,000 per employee. Could we do it over a period of 12 months? I mean, 5,000 once, it seems like.
Let's not drag this out any longer than we have to.
No, I mean,
You can also cap it.
What we can or can't do, okay?
Yeah,
do we make
cap
it,
it.
do we pay it in installments over 12 months? Like it'd be 500 a month?
What?
Barbara would not like that. We got
Uh,
paper every time.
If I'm the employee, give.
Okay, if I give you 5,000
Donate
bucks,
money.
you might get on a plane or find a job better somewhere else.
That's all right.
That's your
That year's over that we were retaining you for.
No, I'm okay with the timeline. That was my understanding.
So every employee that was hired, let's say after January of 2022, we don't care as much about you because there's a technical way this application, which by the way, doesn't require us to do it anyway. We can do it any way we want, but because we arbitrarily picked that time frame, everybody that was hired after that day, you're not as important to us as far as retention goes.
Look, the retention though is
I hear what
during
you're
the
doing.
COVID period.
I'm just.
I understand that, but the problem is you're putting something into out of perspective, and right now what we are going after. We received a check from the feds for a certain timeline that said, we're going to reward you and your organization for everything that you and your team have done for retaining your people while your numbers were down. Here you go. We want to make sure you take care of it.
I can see that.
So in turn, what we're doing is we're wanting to give a portion of that back to those employees that were here during that timeline to say thank you for putting the boots on the ground when you didn't have to be here. And you've stuck with us now after the pandemic is.
We could lose employees over that. I mean.
Yeah, there's gonna be
there's
chances
a lot of
anyway,
people
but-
You're cutting out of it. And.
Wouldn't be the first time I've upset.
And probably the ones that are the most at risk are the ones that are only been here a year or two. That would say, screw it, I'm going somewhere else.
We can have options, right?
Yeah. Yep, we can have
What we talked about. That's why
So,
we're on board.
I think
said it's
one option could be current employees, right?
I'm gonna look at the law because my understanding is it is a payment. It's a bonus to the district for employees that were retained during COVID.
it's not really a bonus. It is you're returning your
Yes.
employee tax credit.
Trying to keep those people.
They don't, it's not retaining employees now.
Right.
It's retaining
Right.
employees when we were in the state of emergency. And a lot of it was because they were not going to get unemployment insurance.
Correct.
They were staying employed.
And the state of emergency didn't end until May 8th. So
California's February, federal was, California was February, federal was May.
Yeah.
So
Which this is a federal check. Right?
Now, are you an employee?
I'm not.
So in considered an employee, you would have to be getting paid. Now, like the doctors are on contract. The doctors
They're not
are on
employees.
contract.
They're not, employees.
Yeah.
One, only one is.
Okay. So,
And that person is new, so they're not gonna get.
Are you saying you want to give me a bonus?
yeah, I would
Yes.
actually, you're
We would.
worth it.
I
I don't qualify. I don't qualify. But I appreciate the sentiment. Thank you, but I do not qualify.
Well, I guess how's this? You're gonna let us know what we can or can't do.
I will draft a resolution.
I have one other point to make. In terms of how we distribute the money. And example one is, am I understanding this correctly? It's based basically on the amount of time that they work for us. So it's not based on their salary, it's based on time.
Right, yeah.
So you put those hours in, it's so everybody who puts those hours in gets the same amount of money. If you put,
That is correct.
if you put less hours in, you get less money.
That was the.
So in my mind, example one is the most fair way to do it. Limited to those employees that fall within that time frame.
Well, like I said, the only difference there is the dollars probably will go higher if we decide
Right.
to use that pool,
Right.
because it'll be. less.
Understood. If we cap it, we're gonna cap it at 785 or something.
Yeah.
And see what those numbers come back and look like.
Yeah.
But I guess that's what I'm hoping that they come back with for us to vote on next time.
Well, let's see what they come back with and we can vote on it at the next.
So when you got team members, Russ, the team, it doesn't make any difference if they've been there 100 years or 50 years, you're all pulling together at the same time. We want to keep them doing that. They're awesome. Everybody in this hospital. So.
I disagree with that approach.
Well, that's the first time you ever disagreed with me.
I think you're basically rewarding for the amount of weight that they carry. And I think that's a fair way to do it.
Well, either way, they'll bring it to us at the next one.
Yeah,
Right.
yeah. Scott knows exactly what we want to argue about.
I'll bring a bottle of Tums.
It was a good idea you were here today.
We will,
Always also works better.
we'll give you guys flexibility to make the decision you want to make next month.
Thank you. I appreciate it, Scott.
I still think the board should get a stipend increase for having to.
Make a motion.
You want to go over the legal ramifications?
What is your stipend?
It's $100 a week.
Yeah, you can't increase that. That's your cap by law. Sorry.
No exception there.
We can actually, you can adopt it by an inflation rate or something, but I don't.
You have
we should
to
go
adopt
there.
an ordinance to do that. So you guys haven't done that.
Yeah, that's all right.
All right, I'll let.
Pay for my antacid, so.
I'm sorry.
It's actually not you.
Mr. Parks,
Do you need to plug in?
Yes. No, oh, is that me?
that's you.
It's
in.
okay.
Yeah.
I'll be okay. It sounds like it ran out.
Go ahead, plug in.
No, it'll be fine. I'm just gonna turn it off. I'm sorry.
Don't be sorry.
It's all right.
So if you fall over, I'm not giving you the money.
Well, he's in a hospital. So.
Please don't let me know.
There you go.
You know who's here is Greg. Sorry, Greg.
That's right. We're just figuring out who's gonna do mouth to mouth.
Oh, yeah.
Yeah, really.
We love you.
I'm trained and
Did you read over the resolution for the editing? Did you read over the last 5 pages? Because we did that specifically for you.
We don't need all the pages. That was only one thing I was asking for.
And which we put in for you.
That the board's notified. That's it.
Yes.
That now we haven't been notified and it's been edited.
It's been done for you.
Who does the editing?
Yes.
Yeah.
I don't believe that there's any editing ever.
We did one because there was an issue that came up with, or two, that came up with because of a comment that was made in here. That
Before the meeting started.
really before the meeting started.
And you didn't.
So, but the
you didn't
record button was on.
modify it?
No, that would be public relations, probably Orion, maybe leaked out of.
Dina's actually the one that.
Oh, Dina, somebody did that.
Or Ryan does it or will do it? I mean, who
because of the potential HIPAA violation, our risk manager shortened it down just to the contents of the meeting. None of the meeting was edited.
Right.
It was the portion beforehand when the recording was started, but before the meeting was called to order.
Okay, but if HIPAA, and I think we mentioned something about Tim in the middle of it, which we shouldn't have done, and I wasn't thinking. He might want it edited out of there. He might-
No, I have no control over that.
No, I'm,
But yes, I understand what you're saying.
okay, then all I wanted to do was for the board to be informed that it was done. So we could see a pattern if it was some abuse or something. I mean, I don't even care, specifics.
Well, and the board has been approved on those 2 occasions, the board was made aware of that. So, and again, we haven't done it since then.
When was that?
That was a while ago.
I think we also discussed, if that came up again, we would figure out a way to bleep or somehow edit that so it's not out in the public before it goes out.
Right. They need to do it up front. The chair, Tim, and I think Scott will
Yeah, Scott's involved in the policy, yeah.
need to do it immediately so that nobody sees it.
Right.
And I don't have a problem with none of that. That's all fine. I just.
My understanding was we would just, like you said, we would not delete that portion, but only silence the portion where the name was stated.
Okay, right. Well, it's the same as deleting if you mute them during that period.
I mean, 1 second, and nobody would probably even notice that that name was not said.
I thought we were saying a bad word.
It's a very small thing, and that's all I wanted.
No problem. That's in there.
Right. Okay.
Yeah, as far as going.
That's it.
No.
Would any motion to approve or change or anything?
I think it's an.
There's no change.
Okay, it's no change.
I was gonna ask to have all my comments that when I was arguing with board members, all edited out.
Well,
You can edit it out, but you can't put it.
we could put a bleep on our.
Director's comments down on the agenda. Australia.
I'll make this brief because we're running long. I want to let y'all know that the Board of Supervisors has appointed me to the Board of Directors of the Current Family Healthcare System. Tim sits on that board also. And I'm the District 1 representative, or there are 2 District 1 representatives, so I'm one of those. A vacancy came open. I'd applied for this years ago and kind of out of the blue, they called and said, "You still want this?" Yeah. So my first meeting probably won't be till August, but what it means for us is that there's going to be another voice on there representing our interests on that board. And so if you have questions about it, please ask away.
Is that a paid position?
No, don't even get a meeting stipend.
No way.
Right.
No, that's awesome.
And those,
Good.
he hasn't seen the board package for those. Those would be 400 pages.
Oh my.
How long do you have to serve?
It's a 3-year term.
Oh,
Good job.
Good
Congratulations.
for you.
Multiple 3 times.
so you can't have a heart attack during it.
I have
That's right.
no comments, but congratulations. 3-year term. Is it a term or a sentence?
I'll let you know.
There's times it feels like a spark. I've been doing it 9 years.
Just Heidi, whenever she. I mean, director's comments for the last meeting. I said that I would rather us management do a better job of making money. I'm working harder. And on the comments that she put on, it said, I recommended working harder, period, like me working harder, and I can't work harder. But management, as far as getting this census up. And finding a way to get better reimbursement and things like that is a factor that we should be working harder. So I would just screw that clean. So that was it.
John?
Yeah, just a quick couple of things. Once again, congratulations, Ross, on that appointment. I was gonna mention that Chet said hi, but I already said that during the meeting. He just happened to be on LinkedIn and said to tell everybody hello at the hospital. He said he is doing a lot better. Also, they had the VFW breakfast today. The VA was supposed to come, but they couldn't make it, so they're gonna come next month, and they would still love to meet with the hospital administration, do a tour of the campus. And start that process moving forward. And then the last thing is Dave Freeland was at Exchange Club today and he had, I don't know where he got these, but he got like 600 syringe barrels. I think it was something that his son did with the medical industry, but they're unopened and unused. So he wanted to know if he could donate them to the
All
hospital.
individually wrapped and stuff like
I
that.
believe so, yeah, about 600 of them, so.
Hey, Mark, can you comment on that? Or did you step out?
Oh, I'm still here. I don't know what a syringe barrel is. Is that the receptacle for a
I believe-
used syringe?
I believe so. I believe that's what it is. It's the,
They're all,
Yeah,
brand
I
new.
mean,
They're
we
all-
could use
they're all
those for
individually
sure.
wrapped.
yeah, they're all brand new. Yeah.
We could use them.
Okay. I'll let Dave Freeland know and
Great.
he can set an appointment with.
Yeah, Christine won't have to buy any red trash. We pay for that stuff based on our disposal though. So I don't know if we have to buy those things at all. I think that we pay for it by disposal. Bob Easterday, are you in the room?
No, he's
He's
not.
not talking
he's
about
not.
the receptacle.
No, he's talking about the syringe itself, not the receptacles that they go in. He's talking about the actual syringes.
Well, what if
Well-
you could just send a picture to somebody so we all know what we're talking about? So
Yeah.
Yeah, with sides.
Yeah, I think we can use unopened stuff anyway, so.
Right.
If not, we can dispose of it.
And it's tax deduction to donate to a government agency.
Okay.
So let them know.
Good.
Write that off.
Yeah, Dave used to be involved with the.
I donate to
hospital
federal government every year, and I don't.
The only comments I have, thank you for the hard work of working with everybody to get a budget in position. I like the fact that we've got a number that's a more realistic number, and that way if our team does well, we go above that number. That's the way I like to approach it. So thank you for all that.
And I do apologize that I'm getting carried away.
I don't mind. Okay, let's get ready to go into closed session.
So who do you guys want in closed session?
Okay, Scott, floor's yours, sir.
Do we have to let anyone back in?
Somebody to let back in.
All right, in closed session, the board presented the CEO with his performance evaluation, no action was taken, no other items were discussed.
Right. Everybody, we're adjourned. Have a great evening. Sorry for the small marathon.
It was a good marathon.
We're
I mean,
adjourned.
it's just
Peace
kind of
out.
like
I appreciate it. Thank you.